Medicare Open Enrollment gives you choices, but the single most dangerous choice you can make is deciding to do nothing at all. The annual enrollment period runs strictly from October 15th to December 7th. If you like your current coverage, the system makes it incredibly easy to stay put. Your plan simply rolls over for the next year without you having to fill out a single form. But there is a massive catch. While the name on your insurance card stays the same, the internal rules, the costs, and the network of doctors behind that card absolutely do not. Your only warning about these shifts is the Annual Notice of Change letter, a document that arrives in your mailbox by late September, detailing every modification to your policy. Taking an hour or two right now to review that letter and compare options is the most effective way to protect yourself from unexpected medical bills or denied prescriptions in the new year. Treat the enrollment window as a mandatory defensive maneuver against the annual degradation of your current coverage. It catches a lot of people off guard that a Medicare Advantage or Part D plan can look so completely different from one year to the next. Every 12 months, insurance companies tear up their existing contracts and renegotiate rates from scratch with hospitals, physicians, and pharmacy networks. At the same time, drug manufacturers adjust their list prices, forcing plans to restructure which medications fall into cheap generic tiers and which get bumped into expensive specialty categories. The government also updates the baseline payment rates it provides to these insurers, which dictates how much money is left over for supplemental benefits like dental, vision, and hearing. You have the fall shopping window to make your choice, ending at this strict deadline, before everything hits a hard reset. On January 1st, all newly negotiated contracts and drug tiers are locked into place for the entire year. Because of this structural reset, a plan that perfectly covered your doctors and medications in 2026 can turn into a major financial liability in 2027. When people do start comparing plans, the most common trap they face is shopping for the lowest premium. Insurance companies still need to make their money. If they aren't collecting a monthly fee from you upfront, they offset that revenue loss by shifting the financial burden to higher deductibles and massive out-of-pocket maximums. This table contrasts the math. Left is a $0 premium plan. Right charges $50, each with different deductibles. A sudden hospitalization forces out-of-pocket payments until hitting limits. Ultimately, the $0 plan costs $1,500 more for the year. Eliminating your fixed monthly costs means taking on significant financial volatility when you need emergency room care. The only accurate way to evaluate a plan's true value is to look at the total estimated annual cost, which combines your premiums, deductibles, copays, and coinsurance into one realistic number. That same careful math has to be applied to your prescription drugs. Assuming your current medications will be covered the exact same way next year is a huge risk. Plan formularies rebuild every January. A $10 Tier 2 medication can easily get reclassified as a Tier 4 drug overnight. Your best defense against these surprise price hikes is running your exact regimen through the Plan Finder tool on Medicare.gov. You must enter your exact dosage and specify whether you take a generic or brand name, because slight variations dictate your drug's pricing tier. You also need to select your preferred local pharmacy. Many plans negotiate steep discounts with specific pharmacy networks, which can drastically lower your copays compared to out-of-network locations. The effort of gathering pill bottles and documenting dosages now prevents the shock of being handed a massive bill at the pharmacy counter in January. Taking the time to input meticulous, accurate data during open enrollment is the only way to lock in predictable out-of-pocket drug costs for the entire upcoming year. Once your medications are sorted, you have to verify your doctors. Relying on a 2026 provider directory to confirm if your specialist is still in network for 2027 is a critical error. Healthcare providers frequently exit specific Medicare Advantage networks at the end of the calendar year as those contract negotiations conclude. The most reliable way to confirm coverage is to call your doctor's billing office directly in November and ask if they are contracted with the specific plan you want for 2027. Finally, before you lock in a decision, you need to check the plan's CMS star rating. This graphic shows how the government scores plans from 1 to 5 stars, grading them on customer experience, wait times, and how often they deny legitimate medical claims. Paying slightly more for a 5-star plan is a highly practical trade-off when it means smoother claims processing and far less time fighting your insurance company over the phone. With those metrics in mind, your exact next steps depend entirely on your current stage of life and health. If you are generally healthy and simply trying to optimize your budget, you need to run your current plan through the Plan Finder to ensure you aren't leaving new supplemental benefits, like expanded dental or vision, on the table. If you have historically let your plan auto-renew, but you have new diagnoses or prescriptions this year, you have to break that habit. You must actively find a policy that aligns with your new medical reality. This flowchart maps out these divergent paths, showing how different health scenarios lead to specific required actions. For adult children helping a relative, you have strict administrative requirements. You must secure their Medicare number, exact prescription list, and documented legal consent. Scheduling dedicated, potentially stressful family time to review these options now prevents a rushed, unilateral decision that could lock a parent into an unworkable plan. Following your specific path is the best way to protect yourself and your family from unnecessarily hitting the $2,100 Part D out-of-pocket cap. All of this preparation has a strict expiration date. The December 7th deadline is absolute. If you miss this window, you are generally locked into your plan's new 2027 rules, network limitations, and drug costs until the following fall, with very few exceptions. The system affords almost zero leniency for missing the deadline. So open your annual Notice of Change letter, input your exact medication dosages into the Plan Finder, and evaluate your choices based on the total estimated annual cost, not just the monthly premium. The cost of complacency is simply too high. Investing an hour of your time to review your options today guarantees your physical and financial health for the entirety of 2027.